Hello, and a warm welcome to the Careers in Public Health series. I'm excited to facilitate this discussion today with Doctors Andrew Hale and Russ Johanson. My name is Allegra Molkenthin, and I graduated from Middlebury this past February with the class of 2019.5. I studied global health and history while on campus, and I'm currently working for AmeriCares, which is a health-focused disaster relief and global health organization that responds to both ongoing crises and natural disasters around the world. I'm really interested in emergency preparedness and more generally ethical humanitarian aid and development. And so today, I'm really glad you all get to hear from two doctors about their careers in public health. So Dr. Andrew Hale is an infectious diseases specialist, medical educator, and researcher. After graduating from Middlebury College, he went to medical school at Tufts University in Boston, Massachusetts. Then he completed residency, chief residency, and fellowship training at Beth Israel Deaconess Medical Center and Harvard Medical School, also in Boston. He is now assistant professor of medicine at the University of Vermont Larner College of Medicine. And in the other Zoom stream, meet Dr. Russ Johanson, who is a practicing emergency physician at Matsu Regional Hospital in Palmer, Alaska. He is the vice president of Matsu Emergency Physicians and on the board of directors for the Alaska chapter of the American College of Emergency Physicians. After graduating from Middlebury, Russ attended the University of Connecticut School of Medicine and then the University of Massachusetts Emergency Medicine Residency Program before moving to the Great White North. So both doctors graduated in the class of 2006 from Middlebury, and they've taught 3 J-term courses together in Vermont in 2011, 2014, and 2017, and they hope to teach many more in coming years. So thank you both so much for joining us today. I would love to just get right into the first questions I have for you. So I'm hoping you can both respond to this first question, which I'm sure many of us are interested in. So if you wouldn't mind just telling us, how did you get to where you are now, and what thoughts and decisions sort of went into following this career path? Maybe that's great, Dr. Johanson.
Sure. Obviously, the highlight of our medical careers is the 3 J-term classes we've taught. But how we ended up here? Well, at Middlebury, I really liked skiing. I joined the Middlebury Ski Patrol. And I still remember my first call there. It was just like a knee sprain, no big deal, but I skied down the mountain with my sled and got there. And despite all my training and passing that class, I had no idea what to do. And I just completely froze up, and it was quite embarrassing. I got yelled at. I think our ski patrol director ended up hiking up the mountain faster than I could ski down with the patient. And I realized I didn't know anything about taking care of people, so I decided to become an EMT. And then my very first call as an EMT, I had a very sick patient who nearly died, and I realized I still didn't know how to take care of people. So then that kind of pushed me to med school. And once in med school, I stuck with the emergency medicine track, and I kind of enjoyed that side of things. And now after residency, after many long years, I feel like I know how to take care of people in a hospital setting with modern medical equipment.
Nice. So me, I've sort of just been intellectually curious about medicine for a long time. I kind of love the intersection between the biology and pathogens and public health and ecosystems and the environment that all play a role with infectious diseases, and you're sort of particularly seeing that come out in the COVID-19 era. Keeps me on my toes. I have a ton of variety day to day. Always have to learn new things. Almost every single day there's about half a dozen things I've never heard of before and need to look up and learn about, and that's fun. It's been a really good job for me.
Awesome. Great. So yeah, Dr. Hale, you mentioned COVID. And so given recent events, I'm sure many watching will be wondering, how do you see the current COVID-19 pandemic affecting your work and also potentially impacting sort of how you think about what you do including the nature of your profession and sort of work-life balance and those sorts of things?
Sure. So so I'm an infectious disease doctor, and so normally I have a lot of diversity in my job. So I do outpatient with people with chronic infections, things like HIV and hepatitis C, for instance. And then I see a lot of inpatients or admitted folks with things like surgical site infections and weird tropical illnesses, and things related to intravenous drug use and all the baggage that comes with that. And then I teach a lot at the med school and do research on infectious disease things. And COVID-19's kind of changed all of that. I mean, it's like all hands on deck and more hands than we have needed on deck to deal with the crisis. And it's sort of the sort of technical details of caring for patients with COVID, but it's also the hospital's response, infection prevention, and it's also sort of society's response. And we also have a big responsibility to make sure the public is informed about COVID. There's a lot of misinformation with all sorts of infections, Lyme disease being an example pre-COVID, but these days there's a tremendous amount of teaching of the public we need to do. So at the patient, the hospital, and the societal level, we're pretty busy these days. But it's it's kind of exciting and interesting and scary all at the same time.
And Dr. Johanson, have you felt the impact of the pandemic in Alaska in your work as well?
We certainly have, and we're kind of behind everyone else in terms of number of cases. It's been slow to spread, but we've been preparing for quite some time. I mean, ever since this hit Seattle, since Seattle's kind of the main thoroughfare to get to Alaska, we thought we'd be hit sooner. And so we've been, even though our patient volumes haven't been crazy, we've been ramping up quite some time, just our preparedness at the hospital. So lots of committees, lots of meetings, lots of changes to our facility. I mean, we put holes in a lot of walls to create better rooms for COVID patients, and we converted an ambulance bay to a big COVID ward. So we've been spending a lot of time preparing, and so far, frankly, it actually hasn't come in handy. Like, we still haven't opened up our ambulance bay for patients, which is a great success of public health initiatives. Of course, many people at the hospital don't see it that way. So it's actually interesting to kind of butt heads with the people who are the bean counters, I guess, who, how much would another cot in the ambulance bay cost? Well, let's not do that. So I haven't been dealing, even though I almost exclusively deal with patients, lately I've been spending more time dealing with administration and preparedness, which is definitely a change, but I think for me it will be temporary.
That makes sense. Well, yeah, fingers crossed the preparation pays off and you won't have to sort of fall back on that. I'm so curious, even now we're seeing an increase in telehealth with virtual doctor appointments and nurse triage lines and other ways to connect patients with healthcare providers. So if you are, maybe not, but I'm wondering how you're thinking about sort of how the nature of medical services might change after this pandemic ends. I'd love to hear from both of you on that.
Yeah, well, I've been doing quite a bit of telemedicine recently. So I do clinic a few times a week. With my HIV patients and hepatitis patients and other folks going through whatever. We don't want to bring them into the hospital right now. They don't want to come into the hospital. We've got dozens of COVID-19 patients in. And so we've been doing, basically Zoom doctor visits. I don't think the patients are ever going to want to come back to clinic again. Like, instead of having, Vermont's a rural place. We have patients that come from 3 hours away each way. And, now they can do a visit with me, in pajamas in their kitchen and not have to commute. And, we don't get to do some things like a physical exam, but we can get a lot done. And, I actually think one of the silver linings of this is that it's going to accelerate, telemedicine as a normal thing, 10 years, 15 years beyond what it would have been otherwise. So yeah, we're doing a lot and patients love it. And, I've done a couple telemedicine clinics from home as well. And it's kind of nice.
Now, Andy, have you experienced patients checking into your Zoom appointments who are busy doing other things at the same time?
Not
Because
yet, but
I have a
I
few
imagine
friends
it'll
who
happen soon.
I have a few friends who have, had to wait for their patients to say, finish checking out at the grocery store.
Yeah.
But
I think, to set expectations appropriately, I guess, and everyone's getting used to the new norm.
But overall, I
Zoom
completely agree
etiquette's definitely a skill, apparently, you need from 2020.
Yeah. But no, I totally agree. I think one of the main concerns about telehealth and telemedicine was lack of quality. I think a lot of clinicians were wary of it because they thought they wouldn't be able to provide good medicine. And I think we've kind of been forced into the role, and we're seeing that it can work in many settings. And I've also been using it within my ER instead of donning burdensome PPE that's in very short supply for a 2-minute conversation. I'll FaceTime with patients who are 10 feet away from me, and it's been quite convenient for us too. And the patients seem to love that as well.
Even like up on our coronavirus, we have several coronavirus sort of dedicated floors at UVM right now. And, if you have to go in the room, you put on the personal protective equipment and you go in, not too big a deal with the right equipment. If you don't have to go in, that is less risk for you, and it saves the equipment for when it's really needed. So we've been doing inpatient telemedicine, which is kind of fascinating. And there's an iPad in the room, an iPad outside the room, and you go and, you talk to them through an iPad, standing 20 feet away from where they are. It's not something I really ever would have imagined would happen 3 months ago, but it works.
From my standpoint, in general, in the emergency room, patients often feel they don't get enough time with a doctor. And I think anecdotally, being able to quickly FaceTime them, update them on their latest test results, tell them what's coming next. I think I'm spending more face-to-face time with patients.
Oh, that's interesting.
Yeah, anecdotally. I don't know if it is true. It seems true.
Thank you. Yeah, that's so great. I think I was going to say sort of shifting gears, but I think it's actually connected in an interesting way. But in the workplace, I feel that I've already seen some benefits of a liberal arts education. So I'm wondering sort of how you feel a Middlebury or a liberal arts education helped contribute to your career decisions, or maybe sort of how you work now, and perhaps in ways that you never anticipated.
I think, being a physician, you kind of at some level, you have to know the basic science. You got to know the pathophysiology and, a lot of that stuff they make you go through for pre-med, it sort of interestingly plays out in the end. That said, a lot of it doesn't. And being a good doctor is really a lot of untrainable skills, like being a nice person and being compassionate, being patient, and being, I think, fundamentally just committed to getting the job done right. And being able to connect with people. And, I think a liberal arts education, for me at least, expanded who I was as a person and my view of the world. And that's made a big difference as a physician. And I also got to meet a lot of really interesting people doing a lot of really different things in life. And that inspired me to take some time off before going to med school. And that was a fantastic decision, and definitely strongly recommend that to anyone thinking about going to medical school. Having balance and perspective, it's good for your own health, and it makes you a better doctor too. So Middlebury, for me at least, played a big role in sort of forming a pretty successful path through that stuff, and keeping balance and keeping a sort of more global perspective on what it really means to be a doc.
Definitely. I can second all of that. I would say, like Andy said, in addition to some of the science not playing out or not being really relevant, like I very rarely use physical chemistry in my day-to-day practice that I know of.
Just a tad, just a little bit.
Yeah, but honestly, the science is the easy part of medicine. Anyone who goes to Middlebury, heck, as I learned from my medical school that was full of non-Middlebury grads, most college graduates can learn medicine. That's not the hard part. Is memorizing a bunch of facts, is anyone can do it, but I think Middlebury taught us how to be better thinkers. And I think that actually really does play into being a better doctor, because the facts are the easy part. How to apply them, whether they're relevant and applicable, that takes more critical reasoning, which I think we learn a lot better.
Definitely. That's good to hear. So many people listening in are likely recently graduated like me, graduating seniors, or other students who are interested in careers in public health. So Dr. Hale, you mentioned taking some time off before med school. I'm wondering if you can share what you think is the best kind of experience to have during a summer internship or a year off to prepare for med school. And or if you sort of want to add on, what is one piece of advice you would like to give to someone who's tuning in today? And
Yeah, I've mentored a lot of folks as they sort of get ready for med school, including a bunch of students that have taken Russ and I's class over the years. And, what I always tell them, and I really fundamentally believe it, is, what is your story for why you're doing this? And like, why do you care? To some degree, if you get like an amazing, you have amazing GPA, or like you do, publish this many papers, or, there's certain sort of paper level things that maybe catch someone's eye. But fundamentally, like, you're going to professional school and you're going to be my colleague one day. I want to know who you are as a person and why you're doing this. And like, what is your story that landed you here? And so definitely take time off if that's something you're passionate about, and do things you're passionate about. I sort of hate this idea that people have to, do a summer of bench research if they hate that kind of thing. I mean, that's not your story. If your story is that you're going to be an amazing physician scientist, then absolutely go get those skills and have that experience. But if your story is you like taking care of people and doing global health, then go do a cool experience in Africa or South America, or, a part of the country that's underserved, and get a cool experience. And it all sort of weaves into this story that makes sense and why you're on this trajectory. I started with this experience, and that led to this sort of deeper experience, all the way up to like why I want to commit my life to being a doctor, which is not a job. It's a lifestyle, much more so than a job. And I just want to know that you're in it for the right reasons, not just because of the so-called prestige or the money, because all that stuff means literally nothing on your third night in a row taking care of people. So you got to be in it for the right reasons, and you got to have to prove your story is a good one for you.
You're taking the words out of my mouth.
We've probably talked about it a lot.
Much more eloquently, but I agree. I think that the worst doctors are those who are boring people and don't do anything else. I think a well-rounded person makes a good doctor. And it's hard to do, because once you get on the med school treadmill, you're working more than you should be. It's hard to do anything else during that time frame. But I think it's important to hold on to what makes you you, and explore that as much as you want before you become a doctor, because it's that much harder after medical school. I also took a year off after Middlebury, and that was a great decision. And I don't think you can take too much time off as long as you're doing something that is developing you personally. And I can't even give examples, because that's so individualized, and there's no wrong answer for each person. But I think that in the end actually makes you a much better doctor.
I'll just jump in off what Russ is saying there. I think, to float our own boat for a second, I actually think of all the doctors I know, I think Russ and I are two of the happier ones. And I think we have done a really good job all the way back to the beginning of med school of staying balanced and true to who we are. We love to ski, we love to climb and hike and do stuff outside. We've got really rich relationships with our partners and all that kind of stuff. And that, that stuff really, really matters. It actually matters more the further you go into it. It's not just like, 4 years of med school, that's intense, we'll sort of pick it back up then. It turns out residency is pretty busy, then fellowship's pretty busy, and, just being a full-on attending doctor is pretty busy. And, you have to love the lifestyle, but you have to have a very clear sense of who you are and what gives you balance, and actively make that balance, or else it'll take it all from you. And that's happened to a lot of folks, and it doesn't work out well. So it's good to be a well-rounded person and to really actively be a well-rounded person in a conscious and active way. And I think Russ is amazing at that.
Well, you're so humble. You're so humble. I think you're right. There are a lot of very unhappy doctors, and it's not because their work is different than our work. It's because of everything else in their life. And I think you're right. It's important that we have not forgotten that. And
yeah, I mean, I love being a doctor. I can't imagine doing anything else, but I'd be very unhappy if that's all I did. You know, you have to have work-life balance. You have to. And I think it makes me a much better doctor to have those things.
Definitely. I always tell people, I'm sure I've told you, Andy, but my year of ski bumming, right? After 120 days of skiing out of 125 days, I didn't want to ski anymore. Like I needed to stop and do something else. And medical school is a lot like that. You're working 120 out of 130 days. And no matter how much you like medicine, like it gets tiring and you need a break. And there needs to be something to fall back on. So.
Well said.
Well, I think that's such a great note to end on. Again, as a recent graduate, I really appreciate your insight into following a career in public health, and especially in these unprecedented circumstances. Thank you both so much for your time and for joining us today.
Oh, thank you for having us.
Been our pleasure, and we'll be back to do J-term sometime soon.